Yeah, so my doctor makes me feel like I'm being heard by asking me, probing questions, kind of diving into what I'm saying, asking me some different things, providing me with different options. She asks me about exercise and diet and, how much physical activity I'm getting. I really see her as a partner in my healthcare.
Well, the thing that's important to me when I go to the doctor's office is that she listens to me and considers my thoughts and my interests and so forth. For example, I'm interested in alternative medicine, and she approved that. She says, let's talk about it. I'm for that also.
Part of our decision to choose this direct primary care physician was that she is also Catholic. So she knew the tenets of our faith. She knew that birth control was not going to be, something that she pushed on us that we weren't going to accept. We were also, trying to conceive, still trying to conceive. And within our faith, we talked about certain things that I don't think that we can necessarily get into with a regular a regular primary care physician. So for example, we don't believe in IVF in our faith, or we don't allow it. And that is something actually within a couple of different doctors that I talked to outside of our faith really sort of pushed on us. They were like, oh, it's scientific, it's great. And that's kind of a hard thing. That's a very hard thing to not have somebody who's a medical professional on your side if you're trying to achieve something. I think that can be a lot of, that could be for any number of things, not even just for faith. If you had an addiction, you would want a doctor who understood where you were coming from and, things like that. And I think having somebody who understands where you're coming from and will support you in order to make whatever changes need to happen in your life is going to help you to have the best health outcome.
He has met most of my family members and knows about them, so that's important too. He knows the community. He's been in the community for over 30 years. He takes care of the local football team during their games and those sort of things. So he's made a lot of connections around the community. And I think this is a very important thing for primary care physicians to have a good connection throughout the community.
I don't know how much I remember about seeing my pediatrician. I remembered that I liked my doctor, Dr. Takagishi. I felt like I could trust him, I guess, even though I was a kid. I think you think about trust differently, but I felt safe at my pediatrician's office. I would say I'm a little intimidated as well by like how to find a good doctor, right? Doctors, a lot of the things that we find that we like to do, especially in a new city like Atlanta, where I don't know it as well, is like you talk to your friends, but people don't really talk to their friends about doctors, right? It's kind of a more private subject. So I know there's doctors' offices around. I know I can look them up online, but I have a hard time knowing what would be a good doctor versus a bad doctor, things like that. So there's a little bit of perceived risk or lack of trust in choosing or finding the right doctor.
There is a team. They have a team. I can call if I can't talk to the doctor. I can talk to someone on their team and they can help me.
Yes, I think what's important is I don't have to be referred out a whole lot because a lot is done in-house. If I want to see a social worker, I can do that right in the office. It is a referral, but I can talk with a social worker right in the office if I'm having any issues.
My practice coordinates the care I get from multiple places. And I think this is an important thing. My primary care doctor treats many of the types of diseases and conditions that are common to primary care, but obviously there are things that need to go elsewhere. And he has a very good knowledge of and appreciation for other providers in the area and knows who to send me to and gives me recommendations that are helpful.
The other thing that I like about my personal doctor is she wants to know about my personal life, and it's comforting to have a doctor that will stick up for you and go to bat for you and know a little bit about what's going on in your life to pass on.
And also, I think all clinics should have a patient advisory board. You knew I was going to say that. I think it's in their best interest. Well, number one, the patient has a voice. If there is something, I think that the medical personnel should hear what the patient has to say and really consider what they're saying. And it could make a difference in how they treat the patient.
I think a big component of modern primary care office to me would be definitely using digital tools. So like applications, telehealth. I would expect to be able to, make and manage my appointments online. I would be able to expect to be able to view results, view my health data online. I would love, like I alluded to earlier, I'm not sure when my last tetanus shot was or if I'm overdue. I would love to be able to just look on my phone and check that or get a notification that, this is about to be overdue. You should be scheduling this appointment, for instance. Like, I guess my story is that when I graduated high school, left my pediatrician, my family also moved to a different state, and I was on my family's insurance. And the way that worked was that the insurance really only held like offices in Colorado as in network, and everything else was considered out of network. And so I was in Michigan, not Colorado, and it meant that I couldn't really get a primary care doctor in Michigan that was covered under an in-network insurance. So I kind of was able to fall out of sync with going to the doctors, doing checkups like that. And then I think it's one of those things where you do that for 4 years. And then when you do, like eventually I got a job and I was on my own employer insurance, and it's easier to sort of go with the flow of how things have been than it is to make a change and start going to the doctor again.
Yeah, I mean, I think mental health is a big thing that I still feel like we are lacking funding for, depression, anxiety, what people are dealing with.
But implementing or embedding mental health in primary care makes a lot of sense. And we'd certainly like to see more of that going on. The other thing about opioid treatment, opioid abuse treatment, My physician does do that. He treats, he's not wide open to that, but he treats patients within his panel of patients that need that kind of help, and he's licensed to do that. Many primary care physicians don't want to get involved, and I think that's a shame.
And I know that care managers are very helpful when it comes to, you know, even the med reconciliation piece, helping patients with that, taking the time because care managers have time. So we don't have a care manager in our office. I don't think we have a registered dietitian on site. And those would be things that I would like to see in my primary care practice, to focus, you know, even more on prevention than just treatment. So
Direct primary care gives us better access and a continuity of care with one physician who is dedicated to just a small set of patients. To us, it means more accessibility, more, it's more focused care. It's not, you know, here's a prescription, you know, see you next time you're not feeling well. You know, I actually get emails from my direct primary care physician. How are you doing? Every 3 months, you know, what's going on? Have you gotten tested? Let's talk about this. How is this going? And that's not something I encountered with any other primary care physician.